Hello, and hopefully where you are, it's a happy and beautiful day right now. Today, I would like to talk about arthritis. Arthritis is one of those things that literally can be crippling the body and the NHS. So many people are in pain because of arthritis, and it's usually because of just one simple reason, and that's the understanding of the cause of the pain of the arthritis has been completely misunderstood, and this is why people are suffering. So a few weeks ago, maybe a month ago, I spoke more about the nutritional aspect when I spoke about psoriatic arthritis. How if you're not getting the right nutrients in your body, you cannot repair joints properly. Hello, Caroline. Hello, Caroline. So I'm not going to cover that today, but this is one of the things you must consider when you've been diagnosed with arthritis, whether it's degenerative arthritis, osteoarthritis, even rheumatoid arthritis, or even gout arthritis. People know there's a link between gout pain and arthritis and what they're eating. But often, even if you had an accident or an injury and you're not healing it can still be nutritional, so you need to look at that. But that's not what I'm going to talk about today. I'm going to talk about muscles and nerves. Very often people have an arthritic, finger, hand, wrist, knee, ankle, and one side hurts, the other side doesn't, one side is wearing down more. No one really asks why is that happening, especially if it's not related to any past accident or injury. Now sometimes it is, but it should still be getting better. So what can you do? Well, one thing that I do is I actually check to see what the muscles around the joint are doing. And a lot of the time with arthritis, it's actually the pain itself is coming from the muscles, and you need to look after the muscles in order to get rid of the pain of the joint. But it goes one step further. Where does the control to the muscles come from? It comes from the nervous system. The nerves control the muscles, and where do the nerves all over? They come down from the spine. And so often we find that arthritis is secondary to the fact that the muscles aren't stable around the joint, and the reason the muscles aren't working as stable is because there's a problem in the spine, very often caused by sitting, little accidents and injuries in the past. And when we identify the specific nerve pathways to the specific muscles, we can actually get things working better again. And yesterday I saw one of my patients with back pain, and I was examining his nerves head to toe, and he'd had a finger that he couldn't straighten, and it had been like this for years. I mean, once he'd warmed it up, it could actually move better. And I identified the fact that there was actually weakness in the nerves coming from the neck down to the fingers. All we did was just gently stimulate the nerves at the level of the neck using something called an activator and using something called a cold laser, and he could actually, he could only do this, okay? And then he could do this, and his finger was straight. And this was after years of supposedly thinking it was arthritis. Yes, there was swelling in the joint. Yes, there was some change in the joint. But what was controlling the function, or the lack of function, was the neck. I had a lady with a really bad bunion, and we couldn't do the muscle test because of the pain. But the muscles that were causing the pain were the ones controlled by nerves from the back. We got the nerves firing to the bunion area, and the pain decreased, and she could move and walk on her foot again. So it's really important that you don't just accept that you've got arthritis and there's nothing you can do. You need to go to someone that's going to be thinking about your nutrition, but also you need to go to someone that can check your spine and check all the muscles. So whether this is a chiropractor or an osteopath, physiotherapist that works with the spine, a sports therapist who knows how to actually not just massage the muscles, but actually physically test the muscle strength and identify the nerve roots that might be the problem. So if you do have arthritis, or if you know someone with arthritis and they're local to us here in sunny Hertfordshire, then by all means pass them our details. That's Body Imbalance, phone number 01707 662 704. If you happen to be miles away, then yeah, I'm quite happy to try and find someone closer to you, or you can go out and search yourself. But please don't just accept that you've got arthritis and the fact that you have to live with it for the rest of your life and go on painkillers. Find the cause and fix it. Everyone, have a happy, beautiful day. Okay? Be well.